So I'm going to be doing cervical traction. This can be done for joint distraction of the cervical vertebrae, also for reduction of pain or muscle spasms, and soft tissue and muscle relaxation of the neck and upper back. This can also be done for joint mobilization in general. Some contraindications would be if she has hypertension, Down syndrome, rheumatoid arthritis, also if her symptoms peripheralize, so if during traction her pain increases or spreads to other extremities. Another contraindication with cervical traction is if she has TMJ problems, because I will be grabbing in that area. So we'll go ahead and get started. I have her in a supine position, and I'm going to place my hands on the back side of her neck, right below her occipital bone, and I'll just use the web spaces of my thumbs to provide support and just pull towards me, so in this direction. With cervical traction, I would want to do about 7% of her body weight for general distraction, which for her would be about 10 pounds. And I would want to hold for 5 seconds and then relax for 5 seconds for about 20 to 30 minutes. If I want to focus on her OA or AA, which is higher up, I would do it like I just did in a neutral position with my force. And then if I want to focus more on her lower cervical vertebrae, I would move her into 20 to 30 degrees of flexion and then provide my force in that direction. Myofascial decompression or cupping is the use of glass or plastic cups that are placed on the skin. These cups are then used to create suction and a vacuum or negative pressure to create vasodilation and increase metabolism and nutrients to the underlying tissues where the cups are placed. So another thing that myofascial decompression does is release the fascia, so it can separate the tissue layers. It can also relax tight muscles and also trigger points. So it's often used for scar tissue or adhesions. Like I said, trigger points, they can be used for entire myofascial lines, so in a large area of the body, and also can be used if there are any suspected connective tissue changes that you believe the cupping can help with. So some contraindications to myofascial decompression would be if the patient already has severe swelling in that area, because it does increase vasodilation, and there can be some problems with that. Also, if the patient is on blood thinners, because it can create some bruising. And also if they have varicose veins, you should avoid that area. Post-surgery, you should try to avoid the surgical area, but after they're healed for so long, it's okay post-surgery. And then also if they have any other skin conditions, so like psoriasis, you wouldn't want to put it directly on that area of skin. So how it works is you select the cup size for the patient, so they are run from really small ones to big cups, depending on the area that you're going to be treating. And then you will apply a lubricant to the area just to reduce friction on the skin, especially if you're going to be having the patient doing any moving or you are going to be moving the cups. And then once you've chosen the cups and the number of cups based on the area you're going to be treating, then you will perform a range of motion assessment on the individual and then place the cups perform the treatment. So the cups will be about 2 to 3 inches apart from each other, and the treatment time can last anywhere from 5 to 15 minutes, depending on what you're planning on doing with the patient. Usually the cups are moved around, or you have the patient do some active movement while the cups are on. And then once you're finished with that, you'll take the cups off and reassess the patient. During the treatment, you're going to want to be aware of the amount of swelling and redness and possible bruising that's occurring in the cups, and also patient comfortability. So if they start saying that the area is getting really irritated and really, really painful, then you would obviously want to stop the treatment and go with another approach. I have case 5, and this patient is a D lineman who is having some pain in his upper trap and neck area, especially with side bending. It says that there have been 2 palpable trigger points in his right upper trap. So I'm assuming that he has a lot of tightness in that area, which is causing the pain when he bends to the opposite side when putting it on a stretch. So I would suggest myofascial decompression for this patient. So I would educate him about what it is and how it works. So the cups will be placed, create suction. It will increase nutrients and blood flow to the tissues and possibly separate tissues, release some fascia, and hopefully provide some relaxation in that area. I would make sure that the patient is not on any blood thinners, does not have any swelling or anything in that area, no skin conditions, and then I would choose a couple cups to cover that area of his upper trap. So probably small or medium cups. He is bigger. He's a D lineman, so probably medium cups, and then place them a couple inches away from one another. I would obviously assess his range of motion before putting the cups on, cervical range of motion, and maybe some shoulder range of motions, scapular range of motion, things like that. And then I would place the cups and have the patient go through some range of motion activities. So some neck flexion and rotation, some shoulder and scapular movements, and then I would be asking the patient how it feels, if it feels like it's getting more relaxed, if the cups are comfortable. I do know that it is a lot of tension with the actual cups on. So then reassessing once you take the cups off, how's the treated area feeling, and then reassessing his range of motion.